Hello, everyone, and welcome. This is the Healing Arts Alliance Education and Training Series, and I'm your host, Jean Adrienne. Today, it's my pleasure to introduce and interview Rene Luna. Rene is a physical therapist here in Tallahassee at a physical therapy center called FYZICAL, FYZICAL. And I found Rene because I was experiencing vertigo. And if you have ever experienced vertigo, you'll know how uncomfortable that can be to try to get up out of bed and find the whole room is spinning and you don't know what's up and what's down or what happened. And the first time I experienced this, I quite frankly thought I was having a stroke. And I went into the bathroom and I started making faces to make sure that I could smile evenly and all that kind of stuff. And my friends told me about Rene. And so here he is. So Rene, welcome first.
Well, first of all, I would like to thank you, Jean, for giving me this opportunity this afternoon to showcase my practice, and I really appreciate it a lot.
Oh, it's my pleasure, because what you do is it's life-changing because you're able to correct vertigo sometimes, bam, just like that. So can you tell the audience what causes vertigo, or what one of the causes? I know there can be many causes, but what is one of the causes of vertigo?
All right. Vertigo is a very complex type of condition that who knows what really causes, but there are several possibilities. The very common cause, in my opinion, is when you develop some form of wear and tear in your inner ear. If you're not getting enough blood flow to your inner ear, there are particles in your inner ear, which is called the utricle. It's like a sac that inside that sac there are hair-like structure. It's called stereocilia. And that stereocilia, on top of them, there are rocks or like, it's called crystals. We call it crystals. It's easy to think of it as crystals. So what it does is it will help give you a sense of balance, or you know where you are in space. Mm-hmm. So somehow for no apparent reason, that those crystals on top of that hair-like structures get out of place, and it's in a form of debris. And when it gets out of place, it gets displaced to the canals. There are canals in our inner ear that has fluids inside that every time we move, it gives us an orientation to keep us in balance. It's like a police, a traffic enforcer that will lead you where you go. And what happened if there is if those crystals or the debris that gets out of place to those canals, you get an illusion of spinning. Mm-hmm. And it is a very horrible experience, because it feels like you are losing control of yourself. That when you spin it's a combination of spinning and falling at the same time. It feels like you're falling into an infinite hole. That it's a very scary feeling.
Absolutely.
And it causes nausea. It causes, in a different, every person is different, but most of the time it is a very awful experience. So what I do is to identify the area, what canal that is affected and which side. And once I recognize the canal that is affected, then I can reposition the head in such a way that it will lead those crystals to get out of the canal. So it will be trash it back to the utricle sac, mm-hmm. to where it belongs. Then once it moves out of the canal, then the illusions of spinning will go away.
Yes, and it's a very it's a fairly quick process. It's painless. And it's a bit scary when you find those crystals that are gone or that are out of place. But you know, it's something that it provided instant relief for me.
For most cases, you get an instant relief. However, there are times that the debris is too big, or there are several debris, not just one, will get stuck in your inner ear. Maybe you will feel better because you remove part of it, but sometimes it will stick. So what I do is to make sure that my patient will be educated and to learn the precautions of what not to do and what to do in order to keep it out of the canals. Because once it gets out, it doesn't mean that it's completely out. It may be sticking right in the bottom of the canal, that any movement of the head it will go back to to the inside of the semicircular canal, which caused another flare-up of vertigo. And there are times that because of the irritation of the debris or the crystals, that you will have some residual dizziness. But if it's completely out, it's clean, there's no more debris inside the canals, you will continue to improve.
And that was the case with me, because when you did that the first time, I had a little bit of dizziness after that, and I came back and saw you in 72 hours, and you checked, and it was gone, and you gave me some exercises, and it's continued just to improve over the last week. And I would have to say that, you know, I'm really good now.
Wonderful. I'm so glad to hear that, Jean. So the problem about there are so many people out there that has experienced vertigo, but most of the time they don't get treated well. Right. They go to see their doctor, and the doctor doesn't know how to treat them. They're just being given medication to mask the dizziness. It's like maclazine or any kind of dizziness medications. Dizzy medications that it's actually making it worse in the long run.
Oh yeah.
So it may go away, but that person will always feel something that is not right. That person feels like it's off. I'm off. You know, it affects your whole body because it will puts the body out of alignment, and not just you feel dizzy, but you feel like your body is not symmetrical, it's not balanced.
Sure.
So it does cause a lot of complications, and it is very, very common to.
So is there a name for this technique that you do?
No. Are you talking about the vertigo, the maneuvers that I do
the testing,
to remove
testing and the maneuvers?
Okay. Now, it's very technical. There are so many maneuvers that we learn to get rid of the crystals. One common maneuver that we do is called Apley maneuver, and it's a very simple maneuver. Once we know the side of the side of the ear that is affected, then we can apply the maneuver to reposition.
So the reason I'm asking you this, Rene, is that there's a good possibility, since this video is going to be on YouTube, that there could be people who see you all over the world, but you're located in Tallahassee. So I would love to have some information so that anybody who sees this interview that can't come to you in Tallahassee would be able to ask for this type of treatment wherever they're located.
Yes, yes. And we have a website. Our website is FYZICAL.com/Tallahassee. So it's FYZICAL.com/Tallahassee, TALLAHASSEE.
Right. Yeah, I know you've got locations sort of all
Yeah.
over the United States.
Yes. My practice, I joined physical in the last 6 years,
Mhm.
and there are a lot of there are several sister clinics
Mhm.
around the U.S. I think it's about 400 clinics right
Good,
now.
good, good. And so
Yes,
they're trained physical therapists in all of those that can do this?
yes, yes.
Perfect.
Most physical clinics specialize in balance,
Okay.
uh, especially treating dizziness.
Right. Yeah, because I mean, I went to you 4 years ago when I first moved to Tallahassee because of my vision, and not having vision in my left eye has caused balance issues for me. And you tested me for that, and so I get that that is really an important part of your work.
Yes, and vertigo is just one condition that we treat, and there are so many other conditions out there. Dizziness is a very vague term or word to
Right.
describe dizziness. Like vertigo is more specific. This equilibrium, wobbly. There are several kinds of dizziness that each person manifests, and the cause is different. Not just because of the crystals, because of maybe the imbalance of the vestibular system. One inner ear is weaker than the other side, or the other side is hyperactive and the other side is hypoactive. It's a term that we use, that one is very sensitive and the other one is less sensitive. And it also affects the brain. If it's people with stroke, neurological issues that is causing them to have balance issues, then we also treat that person differently. So it's a very complex topic, but one common condition that is not quite treated properly with is vertigo,
Mhm.
because a lot of doctors doesn't know how to treat vertigo. But
Exactly.
we physical therapists, we are trained to treat that condition.
Yeah, and balance is so important, especially as you begin to get up in age, like me. When you get to your 70s, you begin to really worry about, or at least I have, about falling because our bones are not as strong necessarily as they used to be, and tripping and falling is kind of potentially a scary thing. So you also work with people about that, right?
Absolutely, it is false prevention is what we're focusing at, because it is a very common problem. I would say one of the biggest cause of death in the United States is from falling.
Hmm.
So if we can prevent falls, we can prevent premature death in the
Yeah,
United States.
exactly.
Um, it is a very common problem that a lot of people have lost their quality of life because
Mhm.
because of just a fall, just one fall. It's not just physically affecting that person, but it's also emotional and mental, because it's very traumatic.
Yeah, absolutely. Absolutely. So, yeah, absolutely. So, this has been really interesting, and I'm sure that this is going to be helpful for so many people. So, thank you so much, Rene, for taking the time out of your busy practice to share your wealth of information with all of our viewers. And I look forward to seeing you again really soon, to work on other issues that are important to me. So, can you again tell people how can they get in touch with you?
Okay. If they're interested, there are two type of patients that we see at the clinic.
Mhm.
Number one are those people that have an acute problem, like they have um, an issue that needs to be addressed right away, like an acute pain of the lower back or shoulder and neck, or any part of the joints that
Mhm.
is affecting their mobility. And those people usually are being referred to us by their doctor, or being referred by their friends and family, or self-referred because somebody they heard from us.
Mhm.
So what we usually do is to evaluate them and go through the process. The other kind of patients that we see are those people that are proactive to their health. They want to prevent problems in their body. So they do something, they treat something before it happens actually. So it's more maintenance or preventative approach type of therapy. So if anyone who is interested to come see us at Physical, our phone number is 850-656-3163, and they can inquire for any information. We also accept insurance. If you do have insurance, we may accept your insurance, or if not, we also have a very affordable out-of-pocket fees. And they once you call, we will give you all the information you need.
Fantastic. So thank you so much, Rene, and I look forward to seeing you again, and have a great, great day.
Thank you, Jean.